What I'm about to tell you may completely change what you drink at night for the rest of your life. Because if you're over 60 and your blood pressure has been creeping up for no obvious reason, there's a chance the problem isn't only what you're eating during the day. It may be what's happening in the final 2 hours before bed. And when I reveal the one drink that has the strongest evidence for gently supporting lower blood pressure at night, you're going to understand why so many seniors miss it, overlook it, or use it the wrong way, and get absolutely no benefit at all. I'm Dr. Aliza Wright, and tonight I need you to stay with me, because this is one of those small habits that can quietly change the direction of your health. Before we begin, please subscribe to my channel and turn on notifications, because these simple, heart-saving lessons could protect you. Now, let me be very clear, because this matters. I am not talking about a miracle cure. I am not talking about something that replaces your prescribed medication. And I'm definitely not talking about one of those sugary internet drinks that promise to melt away hypertension overnight. That kind of language is dangerous. High blood pressure is not a minor inconvenience. It is one of the biggest drivers of stroke, heart failure, kidney damage, memory decline, and sudden emergencies in older adults. But there is one nighttime drink that stands above the rest because it checks several boxes at the same time. It's naturally caffeine-free. It can fit into a calming bedtime routine, and it has actual research behind it. But before I tell you what it is, I need to show you why nighttime is such a critical window. Let me tell you about Eleanor first, because her story explains the real problem better than any textbook ever could. Eleanor was 72, retired, careful, organized, the kind of person who kept every doctor's appointment card in a perfect little stack. Her morning readings were usually acceptable, not perfect, but decent. Then in the evening, especially after dinner, her numbers would climb. 154 over 88, then 160 over 92, then 158 over 90. She thought she was doing everything right. She wasn't smoking. She was taking her medication. She had even stopped salting her food at the table. But every night, her body seemed to be drifting in the wrong direction. And what frightened her most was this. She felt fine. No warning, no pain, no drama. Just numbers climbing in the dark when no one was watching. When I asked Eleanor to walk me through her evening routine, the answer wasn't what she expected. She ate dinner late. She watched the news. She felt tense, but ignored it. Then she had one of 2 drinks before bed, depending on her mood. If she wanted comfort, she drank hot cocoa. If she wanted to relax, she drank a glass of red wine. She thought both were helping her heart. And this is where so many people over 60 get misled. Because nighttime drinks are not neutral. They either support your cardiovascular system or quietly work against it. Alcohol can push blood pressure up, especially over time. Sugary bedtime drinks can spike blood sugar and disrupt sleep. Caffeinated drinks can give you a short-term bump in blood pressure right when your body should be winding down. Eleanor wasn't just choosing drinks. She was choosing signals for her blood vessels every single night. So, what is the best drink before bed if your goal is to support lower blood pressure naturally after 60? It's plain, unsweetened hibiscus tea. Not wine, not hot chocolate, not soda, not that giant mug of sweetened healthy juice. Hibiscus tea. And I know for some people that answer sounds almost too simple. A flower tea? Really? Yes, because the best answers in medicine are often not flashy. They're specific, they're practical, and they work because they line up with how the body actually behaves. Hibiscus tea is naturally caffeine-free, so it doesn't push your pressure upward the way coffee or strong black tea can. It's tart, which means it usually doesn't need much added sweetness. And most importantly, it has been studied in adults with elevated blood pressure and shown a meaningful ability to help bring numbers down over time. Here's what makes hibiscus different from so many bedtime health drinks. It doesn't try to do everything. It does a few important things well. It contains plant compounds that appear to help blood vessels relax and stay more open. It may support better vessel function. It doesn't come with the alcohol problem. It doesn't come with the caffeine problem. And if you drink it plain, it doesn't come with the sugar problem either. That combination matters more than people realize, because a bedtime drink isn't just about one ingredient. It's about what you are replacing. If a senior swaps wine, cola, or sweet cocoa for hibiscus tea, they're often getting a double benefit. They're adding something supportive while removing something harmful. And in medicine, those quiet substitutions are sometimes where the biggest wins happen. Now let me show you why I'm so confident saying hibiscus belongs at the top of the bedtime list. In one human trial, adults with prehypertension or mild hypertension drank hibiscus tea regularly over several weeks, and their systolic blood pressure dropped by a meaningful amount compared with the placebo group. In the people who started with higher readings, the benefit looked even stronger. That matters because seniors with borderline or mildly elevated blood pressure are exactly the group we worry about. They're often not in crisis, but they're drifting. They're accumulating risk. They're heading toward medication changes, more monitoring, more anxiety. And what those findings suggest is that hibiscus tea is not just a soothing beverage. It may become a small daily pressure release valve for the cardiovascular system when used consistently and correctly. Another study on people with stage 1 hypertension found something similar. Those who used hibiscus regularly saw drops in both systolic and diastolic blood pressure that were greater than the control group. And this is what I need you to hear very carefully. Those are not fantasy numbers. Those are the kinds of shifts that doctors actually pay attention to. A few points in blood pressure may not sound dramatic when you're sitting in your living room, but inside the body, a few points matter. They change the strain on the artery wall, they change the workload on the heart, they change long-term stroke risk, they change what happens over years, not just days. So when people dismiss a natural strategy because it only lowers blood pressure a little, they're missing how cardiovascular risk really works. Big outcomes are often shaped by small, repeated improvements. And hibiscus has one more advantage that makes it ideal before bed. It fits the physiology of the evening. Your nighttime routine should be lowering stimulation, lowering tension, lowering needless triggers. That means less caffeine, less alcohol, less sugar, less stress, less screen-fueled agitation. A warm cup of hibiscus tea fits that pattern beautifully.